Briefly talk to you about the new things that have come up in obesity management and diabetes management. Some of you have already seen. So now we know all this, we know about diet, we know about exercise. What has come new are the new medicines. Okay, they just got launched about 2 months back, and another one is going to be launched this month end. And we are also doing now endoscopic procedures. So I'll quickly run through the pros and cons of each of them. So generally with diet, people lose around 5% of their weight. So if you are 100 kgs, you're likely to lose 5 to 7 kgs over a period of 3 to 6 months. But the problem with this is that more than 90% are likely to regain weight. Most of you have experienced it, so I'm not telling you anything new, but this is what we call as yo-yo effect. So diet is very important in patients who have a temporary weight gain. Suppose your weight was 70 kgs, you got pregnant, you gained 10 kgs after delivery. Nobody will advise surgery. You should go for dietary changes and you can lose weight. But it is difficult to have substantial weight loss in patients like you all who had 40, 50 kg extra, and it's difficult to maintain that weight loss. But having good food is important, whether you have surgery, you don't have surgery, for a healthy life. Just like exercise, what Mazda has told, having healthy living, for healthy living, good eating is important, but not for major weight loss. Then quickly coming on the physical exercise. Physical activity is more important for diabetes than for obesity, because physical activity reduces your insulin resistance. So patients who are diabetic or who are pre-diabetic, we emphasize more about exercise. And for overall health, as just discussed, we should all exercise so that our muscles are maintained. Because for weight loss, you need to exercise at least 1 hour a day, minimum 5 days a week, which is, in a city like Mumbai, is mostly unrealistic. Most of us do not have that much time or are not able to sustain. Kalpen is doing, that's a different thing. But not everybody can do that kind of exercise every day. So it's not an effective tool for weight loss, but absolutely essential for everyone, for weight maintenance and for overall health. When I say it's not a good tool, that does not mean you should not exercise. Everybody should exercise. But we should be clear in our mind, why are we exercising? Many of you have young children who are going to gym to lose weight. Do not push them too hard. Do not say you are not exercising enough. You should spend 1 hour extra in the gym. This is not right, because by spending extra time in gym, the person is not going to lose weight. So instead of that, focus more on diet and maybe take somebody's help, whatever is possible. Now, weight loss medicines, I have been part of obesity for almost 25 years. There were hardly any good medicines till last year. Every 4 to 5 years, a new medicine comes. It gets a lot of news coverage. And then it was realized that either patient had heart problems or they had higher rate of suicides. And the medicines were withdrawn by FDA. So this has been the history of weight loss medicines up till now. Now new medicines have come which gives good weight loss. There are different names: Victoza, Ozempic, Mounjaro. You have heard there are even better medicines likely to come. The problem with the medicines that are here right now is that they cost between 15 to 30,000 rupees a month. They are actually become cheap. They were like 1 lakh rupee a month just 3 months back. And they are not covered by insurance. Now, as you know, bariatric surgery is covered by insurance. It's not covered by insurance. 8% patients are not able to tolerate these medicines because they may have nausea, vomiting, diarrhea or constipation. Some of them may form stones in the gallbladder. Some may have pancreatitis. And there are some case reports of cancers of thyroid or pancreas. But they are not very substantial. I'm just putting them there. More important than that is these medicines have to be taken every week for rest of the life. So if you are ready to do that, it's a good option now. Because if you discontinue, weight will come back. It has been shown that weight always comes. It's like diabetes medicines. If you start and if you stop medicines, sugars will go up. So here also, if you stop medicines, this will come up. Now, medicines have become very popular. I'm sure you are watching what is happening on the social media, on TV nowadays. But the problem is, if the weight loss is good, patient has to have enough liquids, patient has to have vitamins and minerals, we have to prevent gallstone formation, exactly like how we manage you. So nowadays we are giving prescriptions for these medicines, but we are taking these patients in our program and managing him the way we manage bariatric patients, the same way. And to prevent muscle loss, they need to have enough proteins. Now, besides balloon, which I have not been promoting much, we have now started doing endoscopic suturing, which is called gastroplasty, which generally leads to 15 to 20 kg weight loss, and people are able to maintain it better. So where do you choose? If you do not want to take medicine and you do not want surgery, then endoscopic suturing can be done. Somebody who is young, not yet married, wants to get married, doesn't want a surgery, probably endoscopic suturing is better than medicine or a balloon, because this gives a more long-term weight loss. I put few slides for bariatric surgery. You are already living it, so I don't need to tell you. With bariatric surgery, you can lose 70 to 100% of your extra weight. And as Shravani has shown, more than 80% patients maintain it even after 10 years. For patients with diabetes, some of them are here, more than 80% will maintain their HbA1c below 7 even after 10 years. And 1/3 of them will remain off medicine even after 10 years. So for diabetes, again, this is the most effective therapy. Actually, it's more effective than even obesity, because sugars get controlled within first 1 month, while weight loss takes 1 year to happen. So for diabetic patients, this is more effective than medicines. And guidelines, this you already know. For diabetes, we can operate even at lower weight. Somebody who is just 7-8 kg overweight, we can offer a surgery. While for obesity, you need to be at least 15 kg overweight. How surgery is different than medicines? When we do surgery, there are multiple changes that are happening in your body. There are multiple hormones like GLP-1, PYY, GIP, amylin, and many more. When the medicine is there, it targets only one hormone. So like Ozempic targets only GLP-1. Mounjaro targets two hormones, GLP-1 and GIP. But when surgery is done, it targets multiple hormones, and that's why the weight loss is substantially more. Besides hormones, it also changes the bacteria in your intestine in a healthy way. And then the only thing that increases energy expenditure besides muscle is surgery. So gastric bypass increases energy expenditure. The only thing that increases energy expenditure is exercise. So this is to give you an idea. I think Madhu was asking about the weight loss. In first month, you should be losing about 10% of your weight, and then 5% every month after that. While in diabetes, as we have discussed, insulin is stopped in almost all patients within 1 week, and medicines reduced within 1 to 3 months. And more important than that is this. Sleep apnea, the CPAP machine can go off in almost 93% patients. So yesterday I got a patient who said, "आपने बोला था sleep app, मेरा CPAP बंद हो जाएगा, मैं तो अभी भी use कर रहा हूँ 3 महीने बाद." So you know, all these are percentages. When we say 93%, it's a major percentage. But you may be in one of those 5 to 7% who will not stop. Acidity improves in 65% patients. In ladies, PCOD and infertility improves in 70% patients. And most important is triglycerides and cholesterol improve substantially. So the risk of heart disease reduced by almost 50%. Even 10 years after surgery, the heart attack risk is less by at least 50%. Even in those who had a heart attack first. So if somebody had a heart attack, we do a bariatric surgery, his possibility of blockage of artery goes down by 56%. Second time, you all know. The arteries can get blocked again. And that's why in those who have diabetes, the lifespan increases by 9 years. Those who don't have diabetes, who are only getting it done for obesity, it increases by about 5 years. I think surgical safety I can skip. All of you know the insurance covers this. But insurance has very definite criteria. So if you fall into that criteria, it's quite likely that you get paid. But there are multiple other factors. Insurance rejections come for various reasons. Sometimes we don't understand any reason. But so it is between the hospital and insurance company. But almost 80% still do the cashless way. So I think that's all I wanted to highlight. Dr. Madhu has got a small presentation on nuts and seeds. Shravani, any questions we can take now or we can take later?